Welcome back, everyone. Hey, ladies, great news. 40 is the new 20, and more than ever, we are seeing women like Halley Barry, Heidi Klum, and many others redefine what women over 40 are like.
But being over 40 does come with particular health concerns. Daytime's resident doctor, cardiologist Dr. Iyengar is here to tell us what women over 40 should look out for.
Good to have you back, Dr. Iyengar.
Hey, thanks for having me.
Yeah, women over 40 are looking good these days.
They're looking great, actually. But the thing is, what we like to tell our patients, or tell women in general, that looking good is not enough. You need to feel good as well.
Right, and you start off with breast health, very important, and mammograms and self-exams.
Exactly, and every female should be undergoing regular self-breast exams. Obviously, that's something that is really pertinent to their overall health. Now, mammograms for women over the age of 40 is part of the annual screening process because early detection of breast cancer saves lives. Now, the thing is, there's a lot of controversy recently about who, and when should get mammograms. Well, that's something each person should have basically a specific discussion with their physician about, because if you have strong risk factors or a family history of breast cancer at an early age, you might need to be screened more often than others.
Okay, and whether or not you do a self-exam is always important.
Absolutely.
Okay.
Now, what about osteoporosis? We're all told about calcium and that sort of thing.
Exactly, and osteoporosis, especially in women who are postmenopausal, is really a risk factor for basically losing bone mass. And basically, if you have osteoporosis, you're at risk of having fractures. So the main thing what we tell women, especially the ones that are over 40 who are premenopausal, it's about diet and it's about doing weight-bearing exercises. So just like you mentioned, vitamin D, calcium, it's really imperative that they have that in their diet. And about 50%, that's half of all Americans, don't get enough calcium in their diet.
And a lot of women hear the word weights and they think, oh, no, no, no. I just want a little cardio. Why would I want to do weights? But just so important.
Exactly, because the weight-bearing exercise will strengthen the bones. And obviously, if you're premenopausal, we want to strengthen the bones before you get to the postmenopausal phase where hormones are lacking.
Right. Okay.
Now, you had mentioned heart health. What else do you look for?
Well, in heart health, obviously being close to my heart, obviously being my specialty, which I tell every patient, especially women though, is that you need to have your cholesterol checked. You need to have your blood pressure checked routinely. And if you have a family history, potentially other screening tests maybe need to be done. So the thing is, what we tell most people is that, listen, you know what? Take some time for yourself. Keep yourself in your mind, because obviously a positive mind leads to a positive body. So it's really important to have the right mindset so that your health comes first before anyone else's. And
you can't assume that your doctor is going to ask for these tests to be done. You have to be your own advocate, right? Can I go in and just say, look, I haven't had all these tests done and I really want them. As my primary physician, would you say, yes, Cindy, we can do all that?
I think there's no way that there's going to be a checklist. No one will ever just say, and that's basically not correct for anyone to say to you, oh, you need to have X, Y, and Z done right off the bat.
Right.
They need to have a talk with you. They need to find out about you. They need to find out about your symptoms. They need to find out about your family history. Only then can you make a real concrete decision on what tests you definitively should have. And like I said, there are some tests some patients may need sooner than others.
Well, how important is it to factor in the me time?
Well, that's a great point, because the thing is that with women over the age of 40, let's be honest, most women have either families, spouses, household issues, jobs. Women tend to put all of these in front of their own lives, and we all know this. And obviously the fact is, what I want to tell women at home is take some me time, because if you don't take time for yourself, no one will give you that time. And that's very important. Making a journal about what you've done in the past week, whether it be exercise, what you've eaten, review it later on and say, listen, I had 30 minutes extra today. Maybe I should go for a walk. Maybe I should take time to get away from the family and take a time and read a book. Do something for yourself, because if you're healthier, chances are everyone else in your family will appreciate it.
You have to change your mindset when it comes to that, because some people would say, well, I feel selfish if I take that time, because really I want to put my family first. But really, if you're not putting yourself first, you're not doing your family any favors at all.
Exactly, and they'll appreciate it in the long run when you're there for them.
And you're happy.
Exactly.
And you're live. Even better.
And I think people might be shocked if they actually took the time to write down what goes into their mouth every day, huh?
True, absolutely, because then they can reflect on saying, my God, look how much I ate this past week, or when I needed to cheat on my diet for whatever reason. It's important to keep that calorie count in mind.
Okay, I just had some kettle corn. I'm writing that down. Dr. Iyengar, thank you very much. We'll be right back with more Daytime. Don't go away.